We watch our members to see what kinds of innovations they produce that really add value to the quality and cost of care for their employees. One of the things we've watched for many years are bundled payments. And some of the procedures that many people undergo, like heart procedures or knee or hip replacements, those can be presented into the marketplace as bundled products, where there's a defined episode of care for a period of time. What we're looking for is a good outcome for the patient for a predictable cost. Now, a good outcome in a case like that means something very specific to the patient. Can they walk again? Can they resume normal activities? Do they feel less pain when they walk? These are things that only patients can really talk about. Well, it turns out that employers have been among the first in the country to try to measure those things and to try to arrange contracts for care for these bundles, these episodes of care for total knees and for heart disease and those kinds of problems. Well, recently Medicare announced a new bundle payment program for total knee and total hip replacements for the Medicare population. In 75 cities around the country, every hospital that provides this care for Medicare beneficiaries will be paid on a fixed bundled payment rate, and they will begin to have the opportunity to report patient-reported outcomes about how well their procedures are helping people recover normal functioning and reduce their pain. These are exactly the kinds of things that employers have been doing for many years. Here in California, we've operated something called the California Joint Replacement Registry, which actually collected data from hospitals about the long-term outcomes of knee and hip surgery. We've been operating a travel surgery bundled payment program for orthopedics, where patients from a number of employers around the country will fly to a destination hospital under a fixed episode type of payment, and also to have their data collected in registries that measure functioning and pain. So employers were early on in trying to develop these programs, and now Medicare is coming in with a very similar program, which will have an impact really nationally.